My name is Dante Downing, and I'm here to show you how to administer insulin subcutaneously. So to begin, we had just received an order for Mr. Frank F. Frankfurter for his insulin, and it is NPH 16 units and regular insulin per his sliding scale, and we just checked his sugar. It was at 248, so we're going to administer 16 units of regular insulin for a combined total of 32. So now that we just got that order and we checked the sugar, we're going to go over to his MAR and confirm that we got the right patient, the right dose, the right drug, the right route, the right time, and the right documentation. And looking at his order, everything matches up correctly. And now that we got that, we are good to begin drawing up his insulin. And before I do that, I'm going to wash my hands. And look at the insulin vials to confirm that it has not passed its expiration date. Its expiration date expires on the December of 2020, so they are good to use. And they are within the 28-day range of being opened, so we are good to use these two vials. And to begin, I'm going to clean the tops of them. And now that that is done, we are ready to begin drawing up the insulin. Open up my vial, syringe. Right. And because we're taking 32 total, we're going to pull back to 32 in his syringe. Alright, and we do draw from clear to cloudy, so we are going to inject 16 into cloudy first, and then inject the 16 remaining air into his clear, and then begin drawing up. Inject the remaining air into there. And draw back 16 units. And then draw the remaining 16 units out of his cloudy insulin. But before I do that, I am going to have a nurse confirm that we have the correct amount out of the first vial.
Looks good. 16, right?
16. And now that we have 16 out of this clear, we're going to take 16 out of this cloudy. No bubbles. And I'm going to have a nurse confirm again.
32.
Perfect. Alright, and now that we're done, we are good to begin. Now before leaving the MAR room, or the med room, I would have checked, or did my second check to make sure that we meet the 6 rights. And everything is in order. We got the right dosage, right patient, right drug, right time, right route, and the right documentation. So we're going to head over to Mr. Frankfurter's room with his insulin. Knock knock.
Hello?
Hello, Mr. Frankfurter. My name is Dante Downing. I am your student nurse for today. We are going to be giving you 32 units of insulin in your abdomen, right upper quadrant. Are you familiar with insulin procedure?
Yes, we do it
Alright.
all the time.
Perfect. So we are good to begin. Before we start, I'm going to wash my hands and don some clean pair of gloves. Could I get your full name and date of birth before we start?
Frank F. Berger, 3/14/50.
Alright, that matches the order. So we just met the 3rd check before we administer. Alright, and the order says that we are giving his insulin injection to his left lower quadrant. We are switching sites from his previous injection. And now I have identified the correct site for his injection. And I'm going to be cleaning with an alcohol. Now, Frank is more of a heavyweight individual, so we are going to be inserting the insulin at a 90-degree angle. If he was more of a underweight, we'd be doing a 45 to 60-degree angle. So now that we have prepped the site, we are good to administer. And then bevel up. And then 90 degrees, I have identified my site. And then straight in. And then slow injection. Alright. Straight out. Discard into a sharps container. Remove my gloves, and there is no, we would assess the site first, there's no redness, no leakage or anything like that, so no need for a cotton ball. I would wash my hands and discard of the dirty gloves. And now that that is done, I would ask Mr. Frankfurter if he needs anything else.
Nope, thanks.
Alright, sounds good. Is there anything else that I can do for you?
Still no.
Alright. Well, I'm going to give you your call light and I'll be heading out. Now that I am done with the procedure, I would head back over to my MAR and document that we gave it into his left lower quadrant, 16 units of regular insulin and 16 units of NPH. In his left lower quadrant, about 1400. Signed with D. Downing, student nurse. And